You're listening to Med School Radio, bringing you the best in medicine. And welcome back to Med School Radio. I'm Simon, and I'm in Tokyo again. This is where I live. Listening to some music from Cinema Paradiso. Love this movie. Anyway, today we're going to be talking about some more pathology, but this time we're going to be talking about dandruff, the cause of dandruff, and a tip for washing your hair, an interesting post by Dr. Krafts. So let's go ahead and start that. Dandruff is one of many clinical manifestations of a disease called seborrheic dermatitis. Seborrheic dermatitis is really common. It affects 1 to 3% of the general population, and it affects areas of the skin with a high density of sebaceous glands, for example, the scalp, the forehead, external auditory canal, nasolabial folds, presternal area. The lesions consist of macules and papules on a red-yellow, greasy base with extensive scaling and crusting. So what causes this disease? You'd think the cause would be overactive or diseased sebaceous glands, but the bulk of the research points towards fungal infection as a primary cause. Malassezia furfur. I'll say that again. Malassezia furfur, that spaghetti and meatballs appearing yeast you learned about microbiology, seems to be the most common culprit. Increased sebum production may play a role in the disease, but it is thought to be a minor role. So if you're looking for an anti-dandruff shampoo, you may want to see if it has some kind of anti-fungal ingredient in it. Sesson Blue, for example, contains selenium sulfide, which has antifungal properties. The main ingredient in Neutrogena T-gel, on the other hand, is coal tar, which mostly just inhibits the formation of keratinocytes, less dead skin cells and less shedding, although a few studies suggest it may have antimicrobial effects. Coal tar does seem to be effective in some patients, so it may be worth a try, assuming you're not averse to putting tar on your head. Also filed under important things I learned from my hairdresser, there is this useful tidbit. Many cases of so-called dandruff are not really due to seborrheic dermatitis, but are simply the result of not rinsing well after shampooing. Shampoo residue can flake off when dry, and it looks like dandruff. So don't skimp on this step of your shower. Who knew studying pathology could have such practical implications? So to read more, go to your Robbins 9th edition, page 1166. Thanks again for tuning in. It was very interesting to learn about dandruff. We learned some interesting things. Think of seborrheic dermatitis, and also think about other causes, natural causes. So tune in next time. Thanks very much. And have a good time studying.